In the most holy name of Allah, beneficent, most merciful, of their ways there is no God but Allah, and that Muhammad is his messenger. I greet all of you, greetings of peace. Assalamu alaikum. So, this is the month of October, and traditionally it is the month that breast cancer awareness is brought to the forefront. So, I just wanted to do a quick presentation about breast cancer because unfortunately everyone does not know the signs, the symptoms, and statistics about breast cancer. So the title of this presentation is What Everyone Should Know About Breast Cancer. My name is Sister Michelle Muhammad. I'm a licensed family nurse practitioner, and I've been a nurse for 30 plus years by the grace of Allah. So the goal of the presentation is to bring awareness of the incidence of breast cancer in the African American community, to discuss factors that increase the cause of breast cancer, and to promote and encourage the use of screening tools for early detection of breast cancer. So we hear this word cancer all the time, cancer, cancer, but what exactly is cancer? So cancer is defined as a disease in which abnormal cells divide uncontrollably and destroy body tissue. So as you can see from this display, the round circles, these are healthy cells. But you have a cell here called cancer cell that does not look like the other cells. And so what happens, you have a cell that is abnormal, and then it begins to divide over and over and over and becomes out of control and starts to destroy the normal tissue. So just a few statistics, and these are updated. The last time I did this presentation was 2016. So these are statistics as of 2025. So breast cancer is the most frequently diagnosed cancer among women. Breast cancer is the second cause of cancer death among women. Lung cancer is number one. Unfortunately, what happens is women get lung cancer and then it spreads to the breast. White women have a higher incidence of breast cancer, but black women have a higher incidence of death from breast cancer. And we'll kind of get into the reasons why this is the case with our black women. In 2025, 316,950 new cases of invasive breast cancer in women and 2,800 new cases of invasive breast cancer in men were diagnosed in the United States. And in 2025, 59,080 new cases of breast cancer inside tubes diagnosed in the United States. So with the next slide, we're going to get a better understanding of the terms invasive breast cancer and breast cancer in situ. So what is the difference between non-invasive breast cancer and breast cancer in situ? The reason why I want to break these two words down is because many times when we're at the doctor's office, they may use words that we do not understand. And so it is our right as a patient receiving health care to have all of our questions answered. However, the provider does not know that you have a question unless you ask it. So if there's something that you don't understand, no matter how many times it needs to be explained, that is your right to have all of your questions answered. But just rest assured that you have to take the initiative to ask the questions, because unfortunately everyone does not ask if you understand or not. So non-invasive breast cancer is a type of cancer that has not spread beyond the milk ducts or lobes in the breast. It is also known as stage 0 breast cancer. So this is the beginning stage. Breast cancer in situ is a type of cancer that is found within the milk ducts. So a simpler term or a simpler way to explain that is Non-invasive breast cancer is local. It's in one spot, and that's stage 0. Breast cancer in situ is cancer that has begun to spread. And that's where you get your stage 1, 2, 3, and 4. So why is there a higher breast cancer death rate among Black and Latino women? One of the reasons is lack of medical coverage. So unfortunately, many in our Black and brown community, either we have no insurance or we are underinsured. And with the health system being based on a money type concept, many times if you do not have medical coverage, or if your medical coverage is not sufficient, you will receive the least amount of care, just enough to get you well enough to go out of the doctor's office or the hospital. Another reason is barriers to early detection and screening. So again, that's why this presentation is important, because we really don't promote mammograms and self-breast exams in our community. And with early detection and screening, that will help increase our mortality rate. Unequal access to improvements in cancer treatment. Some of the newer cancer treatments that you see on television are expensive. All insurance policies do not cover those types of drugs. Some of them are experimental, and so you have to pay out of pocket.
Wow.
And unfortunately, in our community, we may not have the funds or the means or the credit to access different flows of income so that we can pay for these advanced cancer treatments. Another word about unequal access is sometimes in genetic testing, we can find a gene that puts you at risk for developing breast cancer. With that genetic testing, a woman can make a decision to either be proactive and say, okay, well, I want my breast removed, or I want this treatment so it can prolong my life. Angelina Jolie, the actress, is a prime example of this. However, many of us do not have access to the money or the doctors who will do this type of testing and do those types of surgeries and treatments to help prolong our life.
Right.
More aggressive breast tumors are becoming more common in younger Black, Latino women in lower socioeconomic areas. So again, the types of breast cancers that our community have are more aggressive, and it's becoming more common. The more aggressive breast tumors are less responsive to standard treatment. So again, the standard treatment with an aggressive breast tumor may not give the best results. And if you do not have the insurance or the means to have advanced cancer treatment, then there's not much that they will offer you. So you may hear the term risk factors. You have modifiable risk factors and non-modifiable risk factors. A modifiable risk factor is something that you can control. A non-modifiable risk factor is something that you cannot control. So these are some things that we can control in our lives to help lower our risk to develop breast cancer. Alcohol use, obesity, sedentary lifestyle, cigarette use, hormone therapy after menopause, use of oral contraceptives or Depo-Provera, and having no children or having your first child after age 30. So let's talk about each one of these briefly. Alcohol use. Not only does it contribute to cancers of the liver, it can also contribute to cancers of the bladder, breast, and other cancers because of the chemicals used in the production of alcohol. Obesity. Being overweight in conjunction with a sedentary lifestyle is something that we can change as far as a risk factor for developing breast cancer. Cigarette use. Again, remember in the previous slides, the use of cigarettes can cause lung cancer, which can also spread to the breast. Another word on cigarette use, vaping is very popular because a lot of places have no smoking rules, and people who want to smoke choose to vape so that whatever they exhale is not offensive to other people in the area. However, what you inhale from the vape is full of cancer-causing chemicals, and so vaping is no safer than cigarettes or cigars. Hormone therapy after menopause. Some women are not able to control their hot flashes with natural means, and so they may start them on hormone therapy. If you start hormone therapy after menopause, after your menstrual cycles have ceased, you are at higher risk to develop breast cancer. Use of oral contraceptives and Depo-Provera, again, you have that hormone disruption with the oral contraceptives and Depo-Provera. That hormone disruption is a risk factor for breast cancer. And then lastly, having no children or having your first child after age 30 places you at risk because of the fluctuation in estrogen. Estrogen is something that protects our breasts. So if you do not have children, you are not, quote unquote, using your breast, meaning the milk production, lactation, or having your first child after age 30. Estrogen plays a role in that. So non-modifiable risk factors, these are things that we cannot control. We cannot control what our sex is regardless of whether you have surgery or any type of intervention. Genetically, we cannot change our sex. Age, your family history, dense breast tissue, meaning you have more tissue than fat and it's very, very thick. For women, menstruation before age 12, menopause after age 55, and genetics. So just a little word on genetics. You may hear the words BRCA1 and BRCA2. These are gene mutations and they are linked to 5 to 10% of breast cancers in women. The BRCA1 gene causes 55 to 65% chance of breast cancer in women. BRCA2 gene mutation causes 45% chance of breast cancer in women. So with all of that being said, black women are twice as more likely to develop triple negative breast cancer. This cancer is very aggressive with fewer treatment options. So again, back to Angelina Jolie, the actress. She had this testing done because she does have a family history of breast and ovarian cancer. And they found these genes when they did her workup. And so she had an elective double mastectomy, meaning she had a surgery to remove both of her breasts to protect her from getting breast cancer because of her strong family history. Again, many of us in the black and brown community, we do not have access to this kind of testing, and if we do, we don't know what it means, and our doctors are probably not willing to go ahead and do that type of preventive surgery. So, what are the signs and symptoms of breast cancer? What are you supposed to look for? Nipple tenderness, nipple discharge, except if you are breastfeeding, you should have milk. Outside of that, you should not have any discharge. If your nipple turns inward, dimpling of the skin of the breast, similar to a texture of an orange peel, unexplained swelling or change in the size or shape of your breast, change in the skin texture or enlargement of the pores of the skin of the breast, like an orange peel texture, scaling or redness, if you have a lump or thickening near your breast or under your arm. These are all signs and symptoms of breast cancer. And this is not just for women, men also have breast cancer. So this is for everyone.
I know men who get breast cancer.
Yes, sir. Men can get breast cancer. It's rare, but they can still get it. So how do I perform a self-breast exam? These are some steps on what you should do. Stand in front of the mirror with your shoulders straight and hands on both hips and look at your breast. Do not be ashamed, it's just you and the mirror. You should know what your body looks like. Raise both arms above your head in front of the mirror and look at your breast. Look for signs of fluid from the nipples and for any changes in size and the shape of your breast. Lie down, use your right hand to feel your left breast. Use the pad of your first few fingers with a firm, smooth touch and use a circular motion to feel the breast tissue. Make sure to keep your fingers flat and together. Repeat on the opposite side. So you can use the first 3 fingers of your hand. Use your fingertips and keep them flat and together. Excuse me. Cover the entire breast from top to bottom and side to side. Also include your underarm because we have lymph nodes under our arm. And sometimes that is the only indication that something is wrong if we have a lump underneath our arm and the lymph node. So when should I perform my self-breast exam and how often? So they should be performed monthly, 3 to 5 days after your monthly menstrual period ends, if you are still having menstrual cycles. If you are a man or you do not have monthly menstrual cycles, choose one day during the month and remain consistent with that same day. Mammogram, mammogram, mammogram. So, what exactly is a mammogram? It's an x-ray that is a screening tool to examine the breast for calcifications, or what they're looking for is calcium flecks or clusters. They're looking for cysts, which are solid, fluid-filled masses, and fibroadenomas, which are movable, round, solid lumps. So that's what a mammogram looks for. If you're at average risk, meaning you don't have a strong family history of breast cancer and you don't have many of the modifiable risk factors, the recommended age to begin a mammogram is once a year at age 40. For women at higher risk, your physician may recommend a mammogram at an earlier age and more often. And men can also get mammograms. So some closing thoughts. Breast cancer is serious and is not to be taken lightly. Know your breast. You should know your body and what it looks like. Perform your monthly self-breast exams and get an annual mammogram screening. Last but certainly not least, love, 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 love yourself. Any questions? Yes, sir.
What about moles?
So as far as moles can evolve into a cancer. It is more skin cancer and not breast cancer. But again, if you have moles, you should look at them. Make sure that they're not getting larger, that they're not starting to multiply, that the surface is smooth, that it's not cracking, that it's not bleeding. You should still look at your moles because, again, moles can turn into skin cancer. Any other questions? Yes, sir.
How do you graph the mole out?
Are you saying how do they remove the mole?
Yeah.
So there's different ways to remove a mole. The old-timey way is they would tie a string around it, and that cuts off the blood circulation, and then it just falls off. You can still do that. However, I would recommend going to your doctor, and they may still do the same thing. Or if the mole is of a larger size, they can freeze the mole, and then the mole will eventually die and fall off. For some moles that are a little deeper into the skin, you will actually have to have it surgically removed. and it's a same-day surgery. So it kind of depends on the mole, the type of mole, where it is, the size of it. But those are just some different ways to have a mole removed. Yes, sir.
How do a man do an exam of himself, self-exam?
So the same way that women do a self-breast exam, the man does the exact same thing.
Now, what is a self-exam?
So a self-breast exam is where you examine your breasts, meaning, women have breasts, men, you have a chest. But you examine it by looking to see, is anything abnormal, is anything out of place? Is there any fluid leaking from your nipples that should not be? Also to feel the breast tissue, to make sure that there's no lumps, that there's no scales, that there's no redness, there's no swelling. And also examine under your arm the same way to make sure that there's nothing in those lymph nodes that are under your arm. So again, this presentation is not just for women, it's also for men because men do get breast cancer.
So, breast cancer, not only you check your chest, but you check like your arm area
Yes,
also
sir.
too?
Yes, sir.
Okay. Now, what is the age when does that develop? Does it have to come with age or does it come with age?
It doesn't necessarily come with age. There's different factors that come into play when we're talking about breast cancer. You look at what is your family history. Because some people have a very strong family history. Their mother may have it, their sister, other close relatives, and so that puts you at a higher risk. So it kind of depends on what your particular history is.
Does breast cancer have a date of existence?
Like when it was first discovered,
Is that
that I do not know, but I don't mind getting an answer for you.
okay?
Yes, sir.
Because I asked that question because certain cancers, I'm just saying, go back further so I can remember. I remember only thing I remember was a skin cancer.
Yes, sir.
That's the first thing I remember. Not saying that other cancers were available, but that's one of the most common ones out in the field. That's why I said women was next one was discovered.
Yes, sir. And at one time, cancer was what they call a white person's disease.
Yes.
But now it's pervasive in our community, along with high blood pressure, heart disease, stroke. All of that is now in our community. And at one time, it did not used to be that way. And some of that comes from chemicals we're exposed to. Some of it comes from the foods that we eat, lack of exercise, lack of, quality water and food, and even some of the medications that we take contribute to these different types of cancers.
Now, one more question. How do you go around that with your primary care? Because I kind of disagree with it, but primary care, when you go there, checkups like this self-examination once a year,
Yes, sir.
you always ask a question, they do everything through the blood or through the urine. And I asked them a question they have this thing going, quote unquote, by prostate, a certain age you reach,
Yes.
you're supposed to get your prostate. Some people say colon, but the doctor said it'll show up in your blood, it'll cause problem. I disagree with that because I know some people younger people, that's what make me they die from certain cancer. I said, I know it's breast cancer month, but I'm kind of
Yes, sir.
still coming to the information. They catch their cancer later.
Right.
Because, and then by the time they catch it, they be in the stage where they're going to be, the treatment just going to keep them,
Right.
their life balance out. Then the next stage is death after that.
So I will answer it by saying this. Yes, some of the cancer markers can be found in the blood. However, that is the importance of doing the screening exams at home. Now, as far as checking your prostate, you can't do that at home. That's something that the doctor will have to do because that is a physical manual exam, okay? But if that is something that you want to do for your prostate health, then by all means, ask the doctor to do it. I think, sometimes we rely on the doctor saying, well, this is what you need. We have to learn to be more proactive with our own health. And if we see the incidence of a certain thing rising, then there's nothing wrong with getting checked. Most of the time, what happens if you're talking about prostate cancer, they will draw your blood, and they're looking for a certain level of chemical in your blood. When that level gets to a certain point and it's too high, then that's when they do the manual exam. So it can be two parts. Most of the time, they can pick up what they need to pick up with blood, but when that level gets to a certain amount, then they have to do the manual exam. So it's twofold. Yes, a lot can be picked up in your blood, but then again, some things can't, which is the self-breast exams, that catches a lot early. And just knowing your body, knowing what you normally feel like, knowing your different habits, knowing your bowel habits. There's different things that we need to be in tune with our body a little more. And that can also help to alert the physician that, hey, something is wrong. Any other questions?
How does cancer look?
So it depends. Basically, what cancer is it's an abnormal growth where cells start to multiply abnormally. So, like for example, when we were talking about moles, the mole may change color. It may start to flake, or it may start to get larger. Those are signs that, okay, something is wrong. So, cancer doesn't necessarily have, for the sake of this discussion, there are different things that we can look at with cancer underneath the microscope to say this is the type of cancer that this is, this cancer looks this way and that way. But just in general, again, know your body, know what's supposed to be here. If a mole pops up and it hadn't been there, okay, you need to watch that, because that could be cancer.
Do all cancers show a sign outside the body? I know it's on the inside.
Most of the time they do.
It'll show a sign, whether it's on the inside, it'll show a sign on the outside
Yes.
too.
And again, we're gonna have some more seminars and talks about different cancers, because, you know, breast cancer isn't the only cancer that affects our community. You have prostate, you have colon cancer, you have lung cancer. And all of those different cancers we need to know about, and we need to know what to look for. Not so that we can panic, but so we can be proactive in maintaining our own health.
Thank you, Sister Michelle.
Yes, ma'am. And I thank you all for listening. I thank you for your attention. Assalamu alaikum.
Alaikum salam.